Hello. Well, today I have picked another topical subject, something that most parents probably have experienced is that horrific piercing scream in the middle of the night as you run to your child's bedroom to discover they have an ear infection. Ear infections in that moment, in the dark of the night, are pretty horrific because you can see that your child is in excruciating pain, and there really isn't a whole lot that you can actually do in that particular moment. The pain is often derived from the fact that there is a pressure buildup within the middle ear, usually because of a drainage issue where there's buildup of fluid blocking the eustachian tube in most instances. That then becomes a little bit of a breeding ground, interestingly enough, for bacterial viruses. Typically, what we're discovering in the research is it's more often a virus. And as we know, our kids are exposed to all sorts of bacteria and viruses all the time, and they are literally priming their immune systems as they are exposed to all these different bacteria and viruses. So why is it that they seem to be such a common problem for many children? I guess that was my question. Why is it that children do suffer with ear infections? And is there anything that we can do about it? Typically, and certainly in the past, you might have booked an appointment with your doctor and you might have gone in and you often would have been handed a course of antibiotics. Interestingly enough, the research these days actually negates the efficacy of use of antibiotics for most ear infections, and this is because they've discovered that actually they're not all bacterial in origin. Often they're viral. So an antibiotic is not actually going to help in that situation. And the problem with taking a lot of antibiotics is, they work beautifully when there's a bacterial infection by killing off that bacteria, but they'd also kill off all the other bacteria. Now, your gut, your large intestine, is lined with oodles of bacteria, and most of them are what we call adventitious or good bacteria, and they actually help to form our immune system, and they're really necessary for us to A, build our immune system, and B, to stay healthy and well. So if we take a course of antibiotics, or if we take several courses of antibiotics, this can really destroy our body's natural ability to be healthy and well and to be able to ward off against other bacteria and other infections. We become quite immunocompromised, which is a bit of a horrible negative cycle that it can occur. So I'm kind of pleased to hear that doctors are less often prescribing antibiotics for ear infections. Chiropractic, often look at things a little bit differently. And what we have discovered is that if your nervous system is impeded in any way, because the nerve system controls everything that functions in the body, and probably in this case, more importantly, your immunity, it influences your immunity. What we can find is that if we have interference to the nervous system and how it's able to optimally work, it therefore may lead to, down the track, some sort of illness, sickness, symptom, health expression, which may potentially could have been avoided. So in our experience, what we do find is that particularly when there's subluxation, that's what we call it, or interference, particularly when it's in the cervical spine, in the neck area, particularly in the upper neck area, this can preempt that, causes that interference that then may preempt or follow a cascade down to something like an ear infection or some kind of expression of health. These subluxations often occur more commonly when there's been some sort of stress or trauma onto the baby or the person that the body has not been able to adapt to appropriately at the time. What we find is often if there's been any kind of trauma that has been experienced, particularly during the birth process or even during pregnancy, that trauma could be emotional, but it could also be a physical trauma, or a hard labor or a hard birth or a difficult birth. This can set up this subluxation pattern that potentially can influence, if you like, the plumbing of the ears because the nerve system is not functioning as efficiently as it should be. So getting checked by a chiropractor will ascertain whether there is a subluxation or an interference in that upper cervical region. And certainly what we find is that by removing that or helping the body facilitate that change, that then helps the drainage of that fluid so it doesn't build up and there become a susceptible sort of breeding ground for different viruses or potentially bacteria. So there are lots of things that we can do to try and avoid, I guess, ear infections. But one of them, which is a really simple one, is potentially getting your baby or your child's spine checked by a chiropractor. We can do a quick, simple scan of their spine and neck, and that will really help us determine whether there's any area of subluxation that might necessarily be contributing to this ongoing issue. Anyway, be well everyone out there, and enjoy your winter.